great to be here. I'm going to just, not trying to be perfect here, but okay. So, I am the department chair of the MFT programs for the Chicago School, which is in Southern California. Some people will say to me, oh, you commute to Chicago? Well, no. We have a large MFT program in LA and also in Irvine, which is my home base. And I also have a private practice. I'm a psychologist in San Juan Capistrano with my husband, who is a clinical director for a subacute treatment center in San Juan. And I also did a lot of hours, as those of you who are working on licensure or have completed them know, with behavioral medicine primarily, and also addiction, New Directions for Women, a little bit of time at Matrix when they had something down in Costa Mesa. And so always enjoyed the field, worked with eating disorders as well, and my background training was at Pacifica Graduate Institute, and so it was very much oriented toward Jungian analytic psychology, which I still bring with me to this day when I think about people as what's going on besides the obvious symptomology that they're bringing in. So I wanted to talk today about addicted to perfection because I know that in my work with addicts, and I'm sure that you'll find this to be the case, that's really a big component of people's issue is that either they're striving toward an impossible standard which they can never meet and feel a lot of shame for not meeting, and so the whole cascade starts. You see it more clearly with anorexia because there's the perfectionism of trying to create, I don't know what, I mean, some kind of a perfect body. We don't know because by the time I saw them, they, kind of gone beyond that. So, and it also is part of the issue for most human beings, according to Jung, which is that we don't like to admit our fallibility as humans, and we often mistake perfection for striving for excellence, which is a human possibility. Perfection is not. And sometimes I think in the United States that's kind of heretical to say that, but it's the truth. So part of what I think in our work with clients we have to really hold on to is helping them accept their humanity. So when I used to work with addicts, and they'd have to tell me how special they were because of their specific addiction issue, and I didn't struggle with that kind of an addiction. So people would say, well, then you don't know what it's like. Well, I know it's like to have pain, suffering, loss, abandonment, pretty much all the same things that everybody else does. And the reality is we're all in the same boat, and this is difficult for some people to accept, that they're, even in behavioral medicine, it was almost like people were trying to vie for the worst illness as though they were going to get kind of the special person prize because, they had DID or something like that. Rather than saying, well, we're all in the boat together. That was an ego wound, surprisingly. You wouldn't think that you'd want to have a horrible illness or bad addiction to make yourself special, but on some level people do. I remember one time running a group for women with eating disorders, and generally when you run a group, one of the outcomes, as you know, for group therapy is that people see a universality, right? That, okay, I'm not so bad, other people have this issue. One of the young women came out and said, well, that sucked. Oh, why? Well, I'm not special now because other people have the same issue I do. That was the first time I'd ever heard that. I was just flabbergasted because most people will say, oh, I feel better. I mean, oh my gosh, I can relate to them. So it's a unique combination. So part of my, what I wanted to talk about today was this combination of difficulty sometimes when you're working with somebody who does have an eating disorder, often will flip into alcoholism or some other drug use, or then they're sober from that, and then they go back to their eating disorder. So I wanted to talk a little bit about the challenges of that, because that's a very common issue. So I'm going to start with defining addiction as a compulsion that narrows life down to mere existence. You know, so we all have our DSM, whatever we're using, ICD-10. I mean, they can't make up their minds what we're supposed to use, but we have that. But I really think about it as really it's a compulsion that at the end of the day, you're not even living your life. You're just trying to get, you know, your drug, or you're thinking about getting it, or, you know, that's the whole, it subsumes the humanity of the person. It does organize your life. It's the same with an eating disorder, especially people with anorexia have very strict rituals of eating. It does organize it, and it holds out the possibility of release from shame. And my experience was, unless we got to addressing that issue of shame, I used to say it's like you have this shame button in your head that's on all the time. And the only thing that stops it is your drug of choice for a minute or a little bit. And then as soon as you quit using, or the effects wear off, now it's even worse because you relapse, you know, and it's ongoing. So unless we get to the component of shame, you know, you're just kind of white knuckling through sobriety. So here's some research. Again, probably have to update this, things move so quickly, but up to 50% of individuals with eating disorders abuse alcohol or illicit drugs. So that's a pretty high percentage. Cocaine and amphetamines are most frequently used among adults with anorexia and bulimia, right? Makes sense. I mean, gosh, I remember the Stones song, Mother's Little Helper, anybody? That old? Okay, so, you know, people were prescribed amphetamines to lose weight, mostly women, because that's who wanted to lose weight in the 60s. So, you know, people learn that if I'm using a stimulant, I'm not hungry and I can lose weight easier. Drug use is the strongest among those with binge eating components, and those of you who work with eating disorders know that people who binge get a very similar response after they've done binging. And usually they purge, not always, but usually, and then they're just kind of passed out from it. And there's a stronger correlation of substance abuse and bulimia compared to anorexia, which surprised me before I did this research, because I had worked a lot with women with bulimia, and they always seem to be a little less pathological, to use kind of a negative word, but you know, they tended to be older and a little bit more settled in their lives, but apparently more likely to have to use a substance. And so what we're looking at, and this is also going to set us up for the way Carl Jung looked at substance abuse and addictions. There is a loss of control. And binge eating may also be a future gateway, you know, kind of like a gateway drug to alcohol abuse. As you know, sugar and fat are a significant aspect of this. I remember years ago going to the Betty Ford Center, an alumni dinner, or whatever they call it. And boy, the amount of candy and sweets, you know, and I mean, hey, it's better than being drunk or using, so I, you know, I'm not gonna, but it was definitely a kind of a shocker. And so there's the kind of the sense that certain foods are going to be soothing to you, which is in and of itself, in moderation, isn't a bad thing. I mean, we do have to eat. I mean, that's a normal thing. But it's just the manner in which people are using either restricting from fat, which has its own issues, or binging. So, and then the standard, I'm focusing on eating disorder and substance abuse, is mostly behavioral interventions and cognitive and attitudinal. That's pretty much standard across the board. even though the best predictor of success in treatment, this has been empirically studied for many years, is always the motivation of the client. So that's ironic because most of the clients that one works with in treatment are not that motivated. Who's really motivated? The family, right? Who isn't that who's going, hey, there's a problem? Usually the addict's going, well, I don't know. You ever watch Hoarders? Anybody watch Hoarders? It's a great example because the family's crying and upset and you have to see what this is doing to you, and the hoarder's going, I don't see anything. Well, this piece of paper is valuable to me even though it's moldy and has gum all over it. And so it's a great example though of the focus, even there, of course it's a show, it's not, is on the person who's the least motivated because what they're using, in this case hoarding, is working for them as far as they're concerned. It's their family that's in pain. So, pain is a motivator. That's why people say you have to hit bottom and all that, and it's always amazing to me how much bottom people have to hit. I remember working with a man one time who had lost his family job, and he was on his second he had 2 DUIs and came into treatment because he didn't want to lose his license. Which, okay, whatever gets you into treatment is fine, but golly, your job and family didn't kind of do it for you, but your driver's license, you know. And, well, it was kind of interesting, but it got him in there. So it is the family that we're looking, that I tend to focus on as well when I'm working. If I can get, they're equally resistant, by the way, studies. I just did a whole study on this too, on working with families. They're in the same way that the addict is resistant, families are equally resistant to treatment because I'm not the problem, it's him. So, you know, the apple doesn't fall far from the tree. So when treatment approaches are successful, they generally are going to tie into the motivation factor, and I know you all know this, it's very hard to find that at times, and you know, usually we try to point out how bad somebody's life is, you know, and show it to them, that's marginally successful. And I do think that the success rate would be higher if we could really help people understand that they have a pain that needs to be soothed, and there's other ways to do it than their drug of choice. And sometimes we ignore other approaches to pain, psychological pain relief, in trying to just instill sobriety. So, 12-step has been a proven success rate, and I know there's controversy, and some people think it's a bunch of hooey and, you know, whatever. So, I'm just going to tell you, I am a proponent of it. Carl Jung, I don't know if you know that he was influential in starting 12-step. He had worked with a patient who could not stay sober. He was a very wealthy man, flew to Switzerland and got multiple courses of treatment with Jung, and Jung finally said, you know, and he couldn't stay sober, he was an alcoholic, and he said, I just am not going to be able to help you. You're going to have, the only thing I can think of that would help you would be a radical spiritual experience. So he recommended to him at the time the Oxford group, which was the precursor to the modern day 12-step movement. And then he had connected with Bill W. and Bill W. then subsequently wrote to Carl Jung, and they had a little bit of a interchange. And some of the ideas of Jung you find in 12-step, which is the higher power and the need, however you define higher power, and the need to be have an experience of transcendence. So for Carl Jung, addiction is an indication of spiritual impoverishment. And we're going to use that word in a very broad sense, not within any religious context. It could be, but it could also be, I've worked with young men who find their most spiritual experiences surfing, because they're out on this huge ocean, and it takes them out of themselves for that moment. They're in touch literally with something bigger than them. And lacking an experience of transcendence, it leaves you feeling quite empty, and for a lot of people, using a substance alleviates that. This is why the 12-step insists that you work through the steps. And as a Jungian analyst, or a Jungian psychologist, I would say that I always assume that there's something missing for some living reality of a transcendent experience. No matter, even if somebody's very engaged in their religion and find it meaningful, there's still something missing. And that was one of the reasons why dream work was so important to Jung. So this is just a brief overview of Jung's idea of the psyche, which is the personal and collective unconscious, and then the ego, which is the part that we identify with as me, who I am and who I'm not, what characteristics I have, what I don't have, and then the psyche that contains all of that. The psyche abhors imbalance, and this is where anorexia can be such a good example of that, because after even as much as an anorexic can restrict, they will eventually binge. And we see that in any kind of one-sided behavior. Somebody who, let's say it's not a substance abuse issue, it's somebody who identifies very strongly with a cause is likely to often see anyone against that cause as evil. There's an imbalance there. And then they often will unconsciously act out the evil that they see in other people. So somebody who can't own their own propensity to be unkind, for example, and we've all met people like that who say they're never unkind, well then somebody's going to have to be unkind, and if they're in a relationship with you, it's going to be you. Because I can't be me. I would never do anything to hurt anybody. And yet, as a human being, we're getting back to this addiction, you do hurt people. You may not intend to, or maybe you do, you're in a bad place. But being able to own that is part of what wholeness is about, which was Jung's thought that really what people are striving for, and we should help people strive for, is wholeness. Okay? Which is very different from health or hygiene. Because it might be kind of messy and not so pretty, but there's a wholeness involved. There's a groundedness to it. So perfectionism, as I said earlier, is the core of all addiction, I think. And I'm talking real broad strokes now. We've seen people that have compulsion anyway toward other behaviors work. It's an emphasis on doing rather than being. I used to run groups sometimes just to write out the doing behaviors and then the being ones, which were always like this short because we had a hard time coming up with being. And that it's okay to just be. That's a concept. And then an imbalance between what Jung would call a masculine and feminine response to life. So it didn't mean male or female. A masculine response, which is generally how you get things done, is very linear, goal-directed. You set out, you accomplish things, 1, 2, 3, 4, 5. Okay? That's useful in achieving things and getting things done, but if that's the only thing that you think can be an appropriate response to a situation, you're going to be limited, because sometimes being receptive, which is the feminine response, waiting for the right time, letting things kind of resolve until you get clarity, is a better response. And people generally resist that, especially in our culture, because they see that as being passive and not doing anything. But it is, any woman who's ever been pregnant knows you're not being passive, even though you're not the one literally creating the baby, but you certainly are involved in that. and you're receptive in that you're waiting for the right time for something to be born. So this is a rather countercultural, and yet, again, working with addicts to think about how do we know the right time for something in our lives? How do we know how do we get in touch with what's right for us to pursue in life? Because spending all this time pursuing something that hasn't been helpful to you. So Jung saw addiction really as the inverse of spiritual formation. So if you look at most initiatory rites, let's say, from primitive cultures on up, and there's certain steps you have to take, each step being more difficult with a guide, but to that end of transcendent, dream, vision quests, those kinds of things. And there's and so you work through more and more difficult phases until you finally reach whatever the state is that you're trying to achieve. Addiction promises that end state at the beginning with no work involved. And all the pain takes you down in the opposite direction of transcendence. It promises you that, but it doesn't deliver. So for Jung, and I personally, anecdotally have found this, people that tend toward addiction, I think, have a more affinity toward spirituality. They just don't know it. And they don't have any outlet for it. And I know there's pain involved, family dynamics, but let's face it, I mean, can you find a human that couldn't give you some big stories about their childhood and the pain that they had? Not everyone goes toward the addictive response with that. So I think that there's a temperamental component, as well on family system, but I won't get into that one, of being kind of predisposed. And I think the positive thing is the talent, if you would, toward a spiritual response to life. So as I mentioned, the positive masculine, self-discipline, balance, those are all good things. Positive feminine, diffuse consciousness, receptive, rhythm of nature. So these are aspects that I bring in a lot more into my work with clients because they're not in our culture, they're not taught as a valuable traits. Nobody is going to show you someone who had a receptive response to their sport of choice and waited until they, as they were working and waiting until the right time was to prep for the Olympics. The masculine approach, which is you just do it, you put on your blinders and go for it, is really what we celebrate. But people will tell you when they get to certain levels of achievement that they have paid a high price for that. It's often in the relational area. So then we've got, switching back to kind of looking at how perfectionism shows up in eating disorders, and we've got the negative societal attitudes toward the feminine traits, as I said, which are passive, it's impractical, irrational. If you have a sense that something just isn't right, and someone says, well, how do you know? Prove it. Well, I just know. Well, how? If it isn't touched, felt, seen, we don't validate it, and yet, and what I also find with my clients is that they often are highly intuitive, and that's been schooled out of them because their families thought they were nuts. So they don't know what they know, even though usually what they know is absolutely right on. And then the devaluing that women tend to get in our culture about body. I mean, it's amazing to me. I'll read about some actress who I think is just the epitome of beauty, and well, I don't like the way my nose does this, or and wow, I'm thinking, gosh, she would be the one woman I would think would just think she's perfect. So there is more emphasis for women on their body image as part of their value, and men have their own challenges, I think, and it doesn't mean that men don't have eating disorders, but you just see it more in women. And again, working with addicts, I would be keeping an ear open because nobody's gonna come in if they haven't disclosed that they have an eating disorder and voluntarily admit to it. Just like in my practice, people don't voluntarily admit to how much they're drinking every night. It's usually I have to infer it by the lack of progress and other things. So perfectionism is a rejection of feminine values, and you know, also of the body being good enough. In fact, the idea of being good enough is really, again, a heretical concept for our culture, because it means you're settling. Right? And so there's always, you can always do better. Well, at some point in your life, you get tired of that. And for some people, take a few drinks and let go. Or more than a few. I remember working with New Directions for Women, and a lot of the clients would come in and say, oh, I don't know why I was arrested, I wasn't drinking that much. And you know, they blew a huge blood alcohol level, and I'd say, well, maybe you only had one glass, but it was like this big, you know. Yeah, so let's define this. So as I said, there's this challenge of working with addicts, whether it's food, alcohol, addiction, is helping them overcome the sense of despair and the loss of the high. You know that. There's a, you know, and some of you may have had, we used to have women write, you know, goodbye letters to their drug. And boy, talk about grief of what this represented to them and symbolized to them. So here's a quote from a letter to Bill W. from Carl Jung. The craving for alcohol is the equivalent on a low level of the spiritual thirst for our being, excuse me, for wholeness, the union with God. So this is prior to Bill W. starting 12 Steps, and it was very influential, that idea of spiritual thirst. In fact, Carl Jung thought that there wasn't a coincidence that another name for alcohol is spirits. You ever heard that? So that he didn't think that was a coincidence. He felt that that was absolutely the correct word, even though it's a small spirit. So the idea that what is possible for a human being is you know, is being excellent at something, whole, you know, that's really been replaced with this idea that we actually can become perfect if we just work hard enough at it. And some people's families, of course, exacerbate that, and people naturally give up at some point when they can't do it. And so it's an impossible standard. So what does this mean? Well, admitting you're powerless is terrifying. Admitting you're never going to be perfect can be terrifying. I don't care if somebody's using a substance or not. I worked with an athlete who had been well known, and he got extremely angry at me for even suggesting that he could never be perfect. I mean, he stomps out of the room, and you know, meanwhile he's destroying himself with, I don't remember what, some stimulant, and ruined his whole career. But you know, he didn't want, I thought he might think that this was a little relieving, that he could. I told him, well, I'm not saying he can't be excellent. He didn't want to hear this. So even though he's in treatment at the time, he's had these horrible experiences, giving up the idea that he could be perfect was really terrifying to him. So this will resonate with those of you who are here representing the body, because that is something that has been a shadow side for most of psychotherapy, which is very much a head trip. And that is forgetting that we are embodied beings. And as you know, if you work with eating disorders, people really don't know what even hunger feels like sometimes. I mean, they are so, I used to say to some of my clients, it's like your head is a balloon and you've got a string attached, and that's about how much connection you have to your body, is this little string. And I think though we're all prone to that, you know, those of us who got advanced degrees, we had to use a lot of time and energy to, you know, learn, to ignoring what our body is telling us a lot. And I really think that that is often, and you know, remember Fritz Perls, he was really a master at that. Somebody would be sitting there and their leg would be shaking and he'd say, do that again. What, you know, what comes to mind when you get your leg going? The client will go. They're totally unaware that they were doing that. Oh, my dad, when he was mad. And he'd go into this huge kind of experience that was going on this very unconscious level, but being expressed by the body. Not to mention headaches, you know, I mean, you just name any of the myriad of things that we get. People say, oh, I'm just stressed. But rather than just dismissing it, how about saying, well, what if I listen to it? What if I talk to it? Oh, that's crazy. Well, we do it all the time. We have all kinds of stuff going on in our head. So to cultivate a loving attitude toward the body, very difficult. Okay, so partly in Western culture, coming out of the ancient Greek tradition where the body was something to get rid of and become pure spirit. I think we've inherited that. So what are my real needs? Like, what do I really, am I really hungry, or am I just bored, right? Or thirsty? Or am I lonely? You know, hungry, angry, lonely, tired, right? Do I want to live? Particularly people who restrict. And I also worked with a woman at New Directions who had lost her colon functioning from the amount of alcohol she drank. Young too, probably mid-30s. And I asked her that, do you on some level try to kill yourself? And, well, yeah, I am. Well, it's working. I mean, you're losing, you know, functioning or as we speak. So do I really want to live? Do I want to enter life fully? It's very difficult because people are coming from backgrounds where who did that in their family? They couldn't even find anybody. They're the trailblazers, but you're here to help them do that. You know, that's the wonderful thing about treatment and working with a wise therapist. And we're kind of obligated to do this work ourselves. So sometimes I'm maybe a couple steps ahead of my clients, you know. Sometimes they're catching up and I better get to work. But, you know, if we haven't gone there ourselves in our own way, faced our own terrifying experiences, you know, it's, clients know on some levels that we're just talking from here. So, one thing, where a lot of this comes from is work by Marion Woodman, who is a wonderful Jungian analyst, and worked a lot with females and body image, and she wrote the book Addicted to Perfection and also a lot of other books on that topic. And what she found early on, this would have been probably in the 70s, was that you needed to bring creativity into this work. And so art is a perfect thing to bring in. And it's often not, again, you know, when we're so focused on, you know, CBT is great, you know, but at some point it's thoughts. And, well, where are those thoughts being generated from anyway? You know, what's arising, or those feelings? And how would you express them besides just shoving them down or medicating them? Or yelling or whatever, and art is a way to do that, whether it's dance or music or you know, collages. The idea is to find the still point, as Marion Woodman would say, between the body and the mind, which is Sophia, the goddess of feminine wisdom. So Jungians refer back to a lot of mythologies, because they come from the collective unconscious, they come from the unconscious of a whole culture. And they come organically. In other words, you know, somebody had to, they arise because they resonate. So for an example, in our culture, Star Wars has a whole bunch of what they call archetypes. Why are people flocking to those? It's not because, oh, well, it's kind of interesting. No, this is, oh, gosh, I mean, you've got the father-son, right? Big deal, and all kinds of things that really are deep for people. So movies that really strike a chord are a good way to look at what's happening in our culture. But the feminine goddess of wisdom in Greek mythology, relational, allows things to happen in its own good time. And it's when the ego surrenders to something larger wanting to happen. And this is something only the client can kind of get a sense of. You can't tell them what that is, but we've all known when we've just felt called to something, and maybe some of you felt called to this profession. You know, I mean, I remember when I started mid-career with changing from marketing to psychology, and oh, what are you going to do with that? You know, what good is that going to do? And who's going to come to see you? And, you know, well, at that point in my career, it was kind of like, I don't know, but this is something I feel called to do, and I'm just going to step forward. And, at the end of the day, when I die, I don't want to see on my tombstone, well, she colored in the lines and did everything the way society said you're supposed to do, so she gets a gold star on there. So being able to find a calling which may vary. I didn't think I'd be an administrator for in fact, this is ironic, never say never, because my mother had been a teacher at Pierce Junior College for like 45 years. And she's always saying, you ought to go into teaching. No, I'm not ever going to be a teacher. And of course, I get my doctorate, somebody says, hey, you want to teach? I go, well, sure, I can use the money. And then it's like, oh, I really like this. Shoot. I can never admit this to my mom. So what I suggest to clients is kind of setting aside time each day just for your own self. Wow, what a concept. You know, sitting quietly, that's why I love mindfulness, because it has the attitude of being open to whatever's going on in the moment, the breeze and the air. But boy, is it tough. You know, you sit down and you're like, shoot, did I turn off the water under the bottom? Yeah, I did, okay. And then you're sitting quietly and then, gosh, I should probably call. You know, and you know, I mean, the whole time is the shoulds and the to-do list. But I've learned that after a while, it's the monkey mind. So the little chattering monkeys they finally quiet down. And my clients have found this to be very helpful. I mean, whatever they're struggling with, to be able to sit quietly and observe what's going on inside and out, in their body, in their feelings, in the air, look at the trees. So recently a study came out that I thought was really fascinating. They had taken, I love how people come up with these really interesting ideas to do research, because I'm not that creative. So they had a group of people go in front of a big tree and look up at the top of the tree for like 10 minutes and report how they felt afterward. And they all felt like awe. And then they had a group go and look up at a tall building. No, didn't have that same experience. It had to be a natural phenomenon. But 10 minutes of looking at the top of a tree to get that experience of wow, you don't have to get bombed out of your mind to get it. You could get it, naturally. And that's just one example. It was just an interesting idea, this experience of awe, of wonder, that just sitting quietly. Now, I know this is hard, especially when what comes up when you're sitting quietly is a lot of shame and pain and how horrible you are. And, that's why I say there needs to be some, what I call the nurturing parent work to develop that. But letting go of judgment, open to receiving. And for some people I've found a walking meditation is better than a sitting one. Journaling, drawing, anything that gets the body involved. And then, of course, moving toward images. So when I listen to people's stories, I listen to them as though they're telling me a dream. And these are all characters in the dream. And then I start to be able to see things a little more symbolically. Because otherwise we get caught up in the problem solving, which our clients think we're supposed to do, right? Well, what good is this doing? You're supposed to tell me what I'm supposed to do. Well, we all know that trick, right? So you, okay, fine. Stop drinking. Well, I can't do that. How come? Well, I don't know. Well, I don't either. That's why we're here. So, the symbolic content of what meaning they bring to all of these interactions, we don't even know. I mean, you know, I have an analyst, he happens to be in Santa Monica, because I can't see my own stuff. One of Jung's proteges said, you can't see your own backside, right? You could say, kick me back there, I don't know. I need somebody to say, hey, you've got this sign on the back of you. So that's what a therapist does. Hey, you've got something back there that you kind of want to take care of. So memories, dreams, daydreams. I do a lot of work with active imagination. Let's play that out. And clients will say, well, that's not really happening. Well, these are the very ones that came in with a panic disorder, right? That's not happening. Yeah, and neither is anything that you just got panicked about. How do you understand that you had a panic attack? It was purely in your mind, which is so, if it can create negative experiences, why don't we use it to create positive? It's the same thing, right? Healing? I absolutely believe that. And it's wonderful if you can create a group where people can share these things in safety. I know that's a real hard thing sometimes, but it multiplies the experience because other people bringing in often stimulate something in somebody else, you know. But you don't need to have a group, and most of my practice is individual, so people will either enact something in the session if it's appropriate, or they'll do some dream work, or even drawing mandalas. I mean, there's just tons of things. So, you know, there's the ideas, and then there's practice, and at some point we have to get, you know, as the Buddhists say, chop wood and carry water. I mean, all these fancy ideas are great, but at the end of the day, you actually have to do something. So, some practical suggestions are to recognize, help a client recognize where I am unconsciously attempting to be perfect, to be everything to everyone else. And, you know, mea culpa, right? I mean, being a mom and, you know, administrator and, you know, 300 students who all are upset with me at a given time. And, you know, you're thinking, oh, I'm supposed to make everyone happy, right? Yeah, good luck. And recognize my chronic habits and discipline the ego with love. In other words, having compassion for oneself is ironically the only way through to healing. A diet toward life, to take care of my body, to listen to it, to want to allow it to heal itself. And you know, a lot of our clients have really done a lot of damage to their body. Rely on my sense of humor. I try to bring that in. Be aware of danger zones each day. So everybody has times when, you know, smokers have lots of little cues that when they're trying to get off smoking nicotine, they, you know, have a cup of coffee, you know, they got to do something else. They got to have another plan because they're going to want to smoke. Set aside some time for mourning the old body if you're working with body image issue, mourning the loss of your drug, because it did feel like a companion or a friend or somebody that was always there for you. We can all debate whether that, you know, was really true, but the experience for the person is really what's important. And those are some references if you're interested in looking into more of, you know, what I referenced in terms of the articles, but also Marion Woodman's book is still out. And she has a lot of good ideas for, you know, kind of expanding on what I just said. So I'm open to any questions, suggestions, comments. Yes?
Hi, I'm Sheena. I didn't get to introduce myself, but thank you for coming out. I
Oh, you're
appreciate your
welcome.
presentation. And I have a question as a young professional coming up in this field. Oftentimes, we might be limited by the organizations that we're working in terms by policies and stuff like that. So, for example, there might be a point in the day where a patient approaches me and recognizes that they're feeling hungry, and this might be one of the first times that they're actually able to access that
Huge
feeling.
breakthrough, huh?
And I'm not able to provide them with any food at that time because of a policy or something, and I want to be able to deliver that message in a loving way and still praise them or honor the fact that they're getting in touch with this part of themselves that they haven't in a long time. How would you maybe respond to that?
Well, I think you said it well, which is to respond in a loving way that, that the policies are this right now, that we only eat at certain times or however it's set up. But that her, first of all, coming to you and saying that is huge. That's, you know, a wonderful thing to celebrate. And then what can we do until the next time we do eat to kind of recognize that and at the same time, you know, see what else is going on. If you have time.
Yeah.
I used to be able to sneak off and find a room and sit. And that can be actually more helpful in some ways because attention from another human in the way that we give them is so rare that it can really feed you in a different way. You know, and nurturing. There's a nurturing, kind, caring person, but it's often a new experience for somebody. So, yeah. Anybody else?
I'd like to know about Pierce. You can tell me about, I'm a graduate of Pierce.
Yes.
That's my selfishness right there, I apologize.
No, my mom started out there in the 60s, teaching speech and oral interp and all that stuff. And yeah, it was a great community college, junior college is what they called it at the
I never
time.
heard of junior college.
Yeah, it was like
When you heard
junior
that, I was like,
college.
wow, that was like shoving me all the way down.
Well,
I'm
in
just kidding, I'm just-
California, you know, kind of started that, right? That idea of a 2-year institution that would then feed into the larger UCs. Now it's kind of getting a little shifted. But, you know, the community college is probably a better name anyway because it really is more integrated into the local community than a UC might be. But, yeah, definitely.
No, that was off topic, I thought.
No, that's fine. Yes?
Hello, I guess a question that you, the topic you brought up in terms of like, because the experience that you have and also your husband working with in treatment
Right.
for addiction. And now, I mean, the recent, I guess that the treatments that are required more by the healthcare, I guess, in that sense, is more influence on evidence-based treatment. And generally, when we talk about depth psychotherapy and those approaches, something that is very limited in terms of like the amount of time that we have here with certain patients, or the availability in terms of also funding. As a company, if I want to go out there and say, hey, you know what, I want to work depth psychotherapy with this patient for 2 years because that's where the addiction is, then they're like, well, no, we're only going to fund you for, let's say, 35 days, and you're on your own. In that sense, the way that the whole thing is shifted is towards CBT per se, or the matrix model, for example. So, and I know you have to be sort of artful in terms of how we can incorporate all aspects into it. What are your suggestions in terms of like for us to be able to implement that in our programs?
So I know that the outcomes for addiction treatment are pretty static. I mean, people can say that they have better results than everybody else, but I wanna see the empirical evidence to that. So, you know, we know that most people go through many treatment experiences. So in some ways, CBT is, you know, preferred because it's quantifiable in some ways. But really, personally, I'd like to see outcomes that are better than what we have, and we don't. I mean, we're pretty stuck with the same ones we've had for 20, 30 years. That being said, I worked in behavioral medicine. We had 2 weeks, if we were lucky, okay? And I was able to, a lot of times, bring in a lot of this stuff into the group experiences. There'd be one or two people that you could see they were just the kind of person that would resonate with these ideas. And I might recommend a book or an idea to them that they pick up on and run with, and then they'll go out and work with somebody. I used to do groups of didactic. I did process and didactic, so process was just what it was, but didactic gave me a little more opportunity to bring in, where we do a whole group on shame and how and then work on the nurturing parent. I would do, remember transactional analysis, anybody, TA? So parent, adult, child. I did at least one group on that all the time, which to me is an archetype. Parent, adult, child are archetypes. So I would draw the circle, parent, adult, child, critical parent, and everybody always said, oh yeah. I mean, it wasn't like, what are you talking about? Oh yeah, I know that critical parent voice. And the rebellious child, okay, screw you, I'm just gonna get drunk. Or the adaptive child, you're right, I'm a screw up. And then we'd start working with how do we become a nurturing parent to ourselves, which is it is a longer process. So depth psychology doesn't need to be years and years. And I understand that there's what you need to do initially to get your first, 30 days of sobriety. That's why we have inpatient programs where people are just, it's harder to get the stuff. We all know they can still get it. But at least they're getting some time away and getting introduced to some of these ideas. But that's just the start. I mean, New Directions was a year of different levels for women. And even after a year, you felt, there were some people you felt a little bit anxious about because it hadn't really stuck yet. So it's a journey, But I think to let people know about the idea that this is a journey and this is life, and everyone has something that they're struggling with, everyone. There's no human out there that doesn't. And so we're in this together. You've got your issue, I have mine. What are we, what's helpful to people? And I think you can bring that into a lot of situations. And I actually did a few dream groups with people, which they loved. People just, usually will bring in one they've had for a long time and they want to know, what was going on. So people can get very interested in their own selves when you open up to the possibility that you're more than just your diagnosis. So, you had a question?
Yeah, you briefly, I think you just touched on it, the temperamental component.
Yeah.
And could you just kind of elaborate a little bit on that?
Sure, absolutely. So my other, the way I probably work day to day is with Bowen Family Systems, conceptually. And so you'll see, I just saw this yesterday, drawing a family diagram, and you'll have like 5 kids, and one will be an addict. And so what is it about that one kid that the other ones aren't necessarily? Sometimes everyone is, low family is, but sometimes it's just one. To me, and I asked the client that I was seeing, who was the older sister of this young man, and I said, my experience is that the person who becomes an addict in a family of several kids is often the one that was the most sensitive. And so, in her case, her older brother just dealt with the issues by hanging out in his room and closing the door. Okay, so then it came down to her, and then finally her middle brother, who became an addict at age 14. So he's more sensitive temperamentally. I think that there's just, and we know that. I mean, people are born into this world with certain temperament. And I do think that sensitivity also can be, allow them to be more open to things of a spiritual nature, but they haven't had the opportunity for that. I mean, if you're starting at age 13, you really didn't have a chance. And when I mention this to clients who are struggling with addiction, they have generally collaborated with me, that they were more sensitive. They always felt kind of weird. Maybe they were the one in their family that felt sensitive, and everybody else kind of shined on their rageaholic dad or whatever. I do think that there's a combination of the environment and then just the temperament, and who knows what else. We can say genetic, but as a family systems person, because it's all inference, we have not found a gene. I think it's really a predisposition in the family system that goes way back. Whether you inherited it through your DNA or just from the fact that your family has this, it doesn't really matter. You still have to deal with it, with what you've got. So that can be helpful though, because people feel so ashamed and they're such losers, and they have all these, and people have told them that. When you tell them, well, actually I think you're rather talented, you're probably more talented in the spiritual arena than most people. It's kind of shocking to them that they would have anything to offer anybody. Now, I think it's true. I'm not just, BSing people to make them feel good. And that's why I think the 12-step is so wonderful, because when people get it, and you can always tell when they really got it, and they're not just kind of going, oh yeah, have you got a sponsor? No, I haven't found one yet. It's been a year, I mean, really. And then there's those that really get it, and there's a qualitative difference when you're with that person. And I don't know how to express it any other than there's a groundedness and a humbleness, and I don't know, it's cool. So anyway, that's what I would say about temperament. I haven't studied it, so anybody who's going to be doing a doctorate and want to do a dissertation, that would be a cool one to do. I'll throw that out there.
All right, thank you.
Good, well, thank you very much for having me. It was so nice to meet you.